breakfast this morning, if you've sat on a bus or a train or been anywhere recently, you will have just
or
heard...
in an office.
Yeah, you'll have just heard constant coughing all around you. It seems like everyone is battling a bug at the moment.
Yeah, now the chair of the Royal College of GPs says that winter coughs could be lasting longer this year.
Yeah, she thinks it might be because people are picking up not just one cough, but one infection after another infection. Dr. Helen Wall is with us here in the studio this morning to talk about this, maybe give us some advice as well. What are you seeing, Helen, in your surgery?
Well, just that really. I mean, I don't think you need to be a medical professional to know that there's lots of infections around at the moment, aren't there? Like you said, everybody seems to be unwell, coughing, sneezing, spluttering. So, and we're certainly seeing that in practice on a daily basis.
Why?
Well, I think there's lots of speculation about, isn't there, about, you know, whether these coughs are lasting longer or whether it's recurring infections. I don't think anybody really knows, but, you know, it certainly seems possible that we're picking up one after the other.
But is it because we were all inside for so long and wearing masks for so long and keeping our distance? Is it some kind of like a reaction to that time, do you think?
I think if we look at the science behind it, it's a possibility that we've just lost our resilience to infections, because whenever we are out and about doing our normal day-to-day business, our immunity is constantly running that script in the background, meeting bacteria, meeting viruses. You might not even realise that, you might not even be ill with it, but it's constantly building that resilience and that ability to fight off infection. And perhaps some of us have lost that because we weren't mixing as much as we were. But I think it is all speculation. I think the thing for me is that I do worry that because of all the coughs going about and people saying, you know, you're just picking up a cough after a cough, I think we have to be really careful that we don't miss people who have a cough for another reason. So, you know, if you've got a persistent cough that's going on and on, it could be that you're just picking up recurrent infections. It could be that you've got one that's lasting a long time. It could also be, particularly if you've not had the infection symptoms like fever and being unwell and snotty with it, it could be that there's something underlying that. So you might want to get some medical advice. You might need a chest x-ray.
So what sort of time frame should people be thinking, oh, I need to get this sorted? It's not just a chesty cough. I mean, how long does it go on for before you come to the doctor?
I mean, it is a little bit of a grey area, because we know if somebody's had a really bad chest infection, you might feel better in yourself, but that cough can last for a few weeks after, because your lungs are recovering, your airways are settling down from inflammation. But the ballpark is around 4 weeks. So if somebody's had a persistent cough for 4 weeks or more, particularly if you've been a smoker or if you are a smoker, but anyone, then we would start to think about, you know, do we need to start to do chest x-rays? Do we need to start to investigate this a little bit? That's not to say that everybody who's had a cough for 4 weeks or more needs to panic or that they've got underlying lung cancer or anything like that. It's just a possibility. It just raises a little alarm bell in our head and just makes us think, do we need to think about investigations for this person?
Lots of people I know have had that thing where they've had a really bad cough, maybe felt quite poorly, feel okay, but the cough stays, as you mentioned.
Yes.
What do they do? Do they carry on with normal life, go into an office, a school, a hospital, or do they have to stay at home?
I think it's really hard to tell people to stay at home, isn't it? Because this could go on for weeks. So you see lots of people about going, oh, it's not COVID, you know, I've had this cough for weeks. You know, people are feeling really a bit embarrassed by it, aren't they? So I think the key is, if you are what we call systemically unwell, so that means if you've got a fever, if you're snotty, if you're really sort of unwell in yourself, then obviously the advice is to stay away from people, because that's when you're most infectious and you can pass this on. If you've got a cough that's just lingering and you're through the acute infection, the chances are that, you know, that's just your lungs recovering. So I wouldn't be overly concerned about getting on with normal life with that. But it's difficult for anyone this time. I mean, we've got a real cost of living crisis. I'm seeing patients that don't want to be off work because they can't afford to be. They're not going to get paid. They're worried about being made redundant, losing their job. So I think it's a really, really challenging time for everyone, isn't it?
And it's almost like the social rules have changed through COVID, isn't it? About what's is it acceptable to go to the office, to go to your job with a cough, or it used to be kind of, but you know, is it now? Can we just ask you about this as well? We're intrigued. Saw this story in the front page of the Times this morning. Don't let them eat cake, it says. This report saying new advice is don't bring cakes into the office because of the obesity risk and the health and safety risk, maybe the coughs and spluttering risk as well.
Yeah.
What do you make of that?
It does feel a bit like we're sort of trying to control everything, doesn't it? At the end of the day, you've got to have a little bit of willpower, haven't you? I mean, I think it's been likened to passive smoking, which, I mean, passive smoking, if somebody's smoking next to you, you can't help but inhale that. If someone's got a cake next to you, you don't have to eat it, do you? So I think people have to have a little bit of...
We've still got cake in our office from yesterday, haven't we? Because we had a little bit of a birthday party here yesterday. There you go.
I'll be avoiding that on the way out.
it was absolutely gorgeous
Absolutely
cake, and
delicious,
everybody
yeah.
had a slice of it. So it's-
Yeah, I mean, people have to take some responsibility for their own self, don't they? I think
maybe
we're
just
getting
don't have
a
a
bit.
giant slice of cake. Have
Yeah,
another
and you've got to
slice
have
of-
some pleasures
You
as
have
well,
a
haven't
bigger
you, in the
meal.
workplace? You know, you've got to
Well, I
enjoy.
didn't like to say, John.
Okay, well that's reassuring. I'm glad you're not going to arrest us or something for eating cake yesterday. Thank you so much, Helen. It's interesting, isn't it? It's almost like we're rethinking the whole rules of engagement.
Absolutely, yeah.
After the pandemic.
Yeah,
Thank you.
yeah.
Really useful information.